is 18.28%, folliculitis 9.11%, impetigo 7.55%, furunculosis 2.86%, atopic dermatitis 6.07%, napkin dermatitis 3.11%. This is in a descending order. And you can see the 16 types of dermatosis were seen in 21,725 patients. Only 16 types of dermatosis, but the number of patients are too much, about 89.31%. 167 types of dermatosis were seen in 2,617 patients, which is 10.69%, 8.23% in miscellaneous group, and 2.37% in rare group. Most of the patients were between the age of 2 months to 6 years, which is 67.05%. You can see from this study, the study diseases were more than benign and need more special health care considerations. This is all due to lack of functioning primary health care provision. Number of pediatric dermatologists providing first contact care are limited. From this study, the conclusion is dermatological disorders of pediatric patients have been underestimated in Faisalabad. It's a major healthcare care burden that affects the quality of pediatric patients and their parents' lives. These are the total number of patients visited Children's Hospital during 1 year span, and this is the third most visited specialty after pediatric medicine, pediatric pulmonology, and other pediatric subspecialties are below, like peds neonatology, peds surgery, and etc. The emerging challenges for the dermatologists to prevent and reduce these skin diseases, and special consideration needs to be given to extend public health initiatives for the improvement of skin disorders in children. Why pediatric dermatology? How it is a need of the hour. Total number of patients in this study was 24,342. 16 types of dermatosis were examined in 89.31% patients, and 167 types of dermatosis were in the other groups like miscellaneous and rare groups. 30% were examined by the dermatologist and 70% by the pediatrician and the GPs. This is all due to shortage of pediatric dermatologists nationwide from decades. This is all due to lack of limited pediatric dermatology training of PGs. And there are countless publications and educational activities, especially in Pakistan. This study sought to provide insight into the pediatric dermatology workforce. The theme is completing after this study, incorporating advancement in dermatology. Take-home message: to give awareness about the disease, spend more time on these patients, improve their quality of life by producing qualified pediatric dermatologists in the community. This is the I request my respected chairman and senior colleagues, this is our work to boost them and say to them, Geo, and enjoy life more than normal. And the patient right is always right. And you can see on the picture, right is always on right. You can see on the left side, the number of pediatric patients are more than the health providers. But the number of smiling health providers are more than the patients on the right side. So right is always right. This is the references of this study. And I dedicate this study to Dr. Yasmina Khan for her untiring efforts and dedication for the cause of pediatric dermatology. Thank you. Thank you very much for listening me patiently. And the best human is who feels the pain of others. Thank you very much.